Hi everyone, welcome to the Ravat Show. We are here at AWS re:Invent and look who are with me, Max from Touch Support. Max, welcome to the Ravat Show. It's your debut, super excited to chat today.
Thank you for having me.
Max, I'm kind of curious to learn a little bit about Touch Support and your role there, and then we can get into various discussions around how you've been utilizing Qlik, AWS, and much more.
Absolutely. So I serve as Senior Vice President of Strategy, Operations, and Analytics, which is a very, very fancy title, of course. And really what that means is I'm tasked with driving effective change in our organization and industry.
Right.
So TouchPoint is in the food and support services industry of healthcare operations. And that means we span 15,000 cooks and chefs and housekeepers across the country.
Right.
And what my job is to try to figure out different ways, whether we change processes, build technology, build solutions, and how do we make their jobs easier, better, and more effective for our clients.
That's fantastic. Great role and huge responsibility for sure. I'm kind of, obviously curious to learn what challenges does TouchPoint Support Services face in supporting the frontline support and how is it kind of taking them to the next level as well?
Absolutely. So right now we are in a hyper-growth phase.
Right.
And as we continue to scale a decentralized business, we've got hospitals, 650 different locations across the country. And the challenge is how do we operate consistently at scale? And that's where part of Qlik ties into that, and that's one of the reasons we chose Qlik Answers, is we have so many different proprietary technology products, and you can't go into Google, you can't go into Gemini, you can't go into Claude or ChatGPT. They won't know the answers to these proprietary platforms.
Yes, right.
So we leverage Qlik Answers to create fully fenced different chatbots that serve those different use cases.
Right.
So you know the chemical dilution procedures on specific equipment, so you know how to transfer payroll costs in our proprietary financial system, so you know how to assign tasks within our proprietary task management system.
Very important.
To understand all these different technology platforms and bring that together into specific answers for our end users.
Yeah, you said 650 healthcare facilities is where y'all are using Qlik Answers. That's massive. I'm kind of also wanting to learn what benefits are you seeing so far for the staff and the patients, like in terms of even making the work faster, because what I feel is healthcare is a very sensitive industry altogether. But if there's a technology that can be in place that can help not only just patients to get all their details, even if it's about the medical reports, just in one click, it is a game changer. So how are you all seeing it benefiting the patients and the customers as well, and the staff, I mean?
Sure, so I mean, why we went with it was speed to action.
Right.
And it was consistency at scale and speed to action. So you don't have to wait for someone to answer the phone or to email you back or to call you back and get an answer. You get that instantly within seconds in a way that you can trust. So when we were first evaluating our problem and our use case, and if you walk around here, you're going to hear everyone saying that they do AI and generative AI. We chose Qlik because, ultimately we trusted Qlik.
Yes.
We've been a Qlik customer for 10 plus years. They're reliable. We know them. We're in their ecosystem. There's a speed factor. But ultimately it was about trust and knowing that we could trust them to deliver the right product for us.
And I know for a fact where AWS Bedrock also plays a very key role in powering Qlik Answers, right? So I'm kind of curious to learn and obviously wanting to see how these technologies are helping you get things in real time and how fast they are helping the teams to obviously work on different aspects of the work.
It's our secret sauce, is what it is. So our first chatbot we stood up in minutes. It wasn't a months-long development cycle.
Right.
It was minutes, and it was minutes to continue to add bots. What I've started to tell my team is we're just going to say 24 hours for each new bot that we spin up, just so we're not too fast.
Yeah.
But realistically, we can spin these things up almost instantly and scale them across our operations almost instantly. We initially thought that Qlik would be a great move because that would get a lot of our different teams access to this because they're already in the environment.
Nice.
What we ended up finding is that the advent of Qlik Answers ultimately pushed more people into our Qlik environment because of the use case there.
Yes.
Qlik Answers was our #1 used data product within 30 days.
That's awesome, and good for our audience to also learn about how different technologies kind of come together and how it helps obviously the mission and the goal. And Qlik Answers is definitely doing that for you. I also wanted to touch a little bit on this, obviously this announcement, which was you were recently also selected as AWS GenAI Trailblazer. First of all, congratulations on that. That's massive, and I know how many people, obviously are working on projects, and very few kind of get selected for that. Tell us about what does this recognition mean to you and to TouchPoint Support Services. How does it feel?
It feels amazing. We
Yes.
certainly didn't do it because of that. We did it because we knew we needed to solve a problem in our business. We needed to have the right solution for our teams to act more effectively, to deliver the right outcomes for our clients, for our patients across the country, for our associates across the country. And that's what it means to me, is I'm making 15,000 people's lives better because we're delivering the right different technologies and the right products for them. And they're able to impact further the lives of hundreds of thousands of patients across the country by delivering cleaner facilities, by delivering better food, by delivering better experiences, because these patients aren't in hospitals typically in their best moments. They're there because they're vulnerable, they're there because they're in need of health and a healing environment. And if we can create and leverage technology and data products to make that experience better in someone's toughest moment, that's what we're going to choose to do. So that's why we went with it. That's what it's all about. And the fact that we got recognized as a generative AI trailblazer, it's surreal, but it's also a validation that we are doing the right thing.
The right things. And like I said, healthcare is a very critical, sensitive space, and if anything that's working towards saving lives or helping those in those difficult times, if you all are doing that, it's a game changer. So respect to you and your team for doing that, obviously for the larger community and helping, obviously the patients that come to y'all, and y'all are supporting them non-stop. I'm also wanting to shift gears a little bit towards looking forward and a little bit about the future as well. How are you kind of seeing the space evolving? The Gen AI space is moving very quickly. We see every 6 months there's something new or something that has evolved. How do you kind of keep up with that, first of all? But how are you kind of seeing, say, maybe the next 3 to 4 months, how the space will evolve, and how are you all trying to make sure that that is very much implemented internally as well?
So it's interesting. I feel like the pace of technology evolution is just going faster than ever.
Right.
And we're at this moment where you just have to be extremely comfortable with change. People aren't typically comfortable with change. And it's about getting our teams and our people used to that pace, which is consistently accelerating.
Right.
It's accelerated in the last 3 months. It's going to accelerate more in the next 3 months. From a more tactical perspective, I see a lot more of integrating structured and unstructured data. That's happening already. I see that becoming the next thing that we're doing actively. But beyond that, I just see the pace changing to where we're able to do new and creative things that just wasn't possible a year ago. I remember just even 5 years ago, using unstructured data in the way that we are today, I couldn't have even fathomed that.
Yeah.
I couldn't fathom getting rid of pen and paper, getting rid of binders, and instead having someone interact with a chatbot on their phone to get answers versus flipping a page 267 on one binder, 34 of another, and 53 on the third to get one answer. And we have that today.
Yep.
So I think that's what I'm most excited about, but I'm also fearful of getting that change to happen in the right ways.
Yes, that's so good to hear from an enterprise leader, understanding the risks as well, but at the same time having those guardrails, but innovate very quickly too. One last question, and I promise this is the last one. One advice that you would have for enterprise leaders like yourself who are working in not only just healthcare, but finance or other industries as well, who wish to obviously implement AI or who wish to use Qlik Answers into their systems, what would be your advice?
The biggest challenge that we have is operationalizing that. That's the biggest lift that you have as an organization. It's not about creating the technology.
Right.
It's not about looking at the right solution or picking the right vendor. All of that's important. But what's most important is that you're operationalizing that in your day-to-day actions. That housekeeper is doing things differently. That cook, that chef is doing things differently each and every day. And the way to do that and to create that positive and long-lasting change is to sell them on the why. That's what we do, is we embed them into the process.
Right.
We sell them the why so that they want to use this. It's not mandatory, it's not a have to. This is going to make your day-to-day better, easier, and you're going to be able to deliver better services to your patients.
I love it. I love this advice in how you've kind of put across to the enterprise leaders. It will definitely help them. Okay, one last question, I promise.
You can ask me as many questions as you want.
Okay, if people want to reach out to you, learn more about the different things that you and your team have been doing, where can they follow you and also follow, obviously, the team? Is there a particular website that they can look at? And I think for you it would be LinkedIn, but I'll leave it up to you.
Yeah, LinkedIn would be great. Max Mosky on LinkedIn, and then our organization's TouchPoint Support Services. You can find us on LinkedIn or touchpointsupportservices.com.
Fantastic. This is great. Max, first of all, thanks for doing this. I had a blast. I learned a lot, and you and your team have been solving a very important problem for the society, for the community. Keep up the great work. We'll keep supporting, and we'll obviously keep the conversation going, and I'm pretty sure we'll chat soon. Thank you very much.
Thank you.
Thank you. Thank you everyone for joining us today.